the medical center, and I've assigned by the doctor to inform me about insulin injection. Have you heard about anything before from your previous visit?
No, sister.
Okay, but before we go further, can you tell me your name so that I can confirm with my record, please?
My name is John.
John, so I'm talking with the right patient. So the reason for the visit is to instruct you how to take injections. And now I'm asking you if you have had any information about this from your GP after your previous visit.
Sister, I have suffering from this diabetes for long years, and I am managing with my condition with diet and tablet. Then I don't know why doctor asked to take the injection. I don't know the reason.
Yeah, it's high time for you to take the injection, John, because your tablets and diets are failing to control your sugar level. Your sugar levels have been fluctuating, so the doctor has found it necessary to give you injections to stabilize the whole situation. Does this sound good for you, John?
But sister, I am so worried about the injection because I don't know. I heard that the insulin injection will sometimes reduce the blood sugar level, and the patient is having some unconsciousness and like that. So that I am feared about to take the injection, sister.
Thanks for your information and to share your concerns with me, John. But what I want to assure you is that taking the injections will make your blood sugar level manageable, and as a result, you won't have fluctuating sugar levels. And what we have heard about unconsciousness and other side effects of taking the injection is a result of failing to take the injection at the appropriate time. If you take your injection in time and stick to the directions of your doctor, you won't have any problems. You manage to lead a very active life without worrying about high or low blood sugar levels at any time. Do you have any other worries, John, so that I can explain further?
Okay, sister. Then I don't know how to take the injection, and do you teach me?
Yes, I've got the time to teach you to administer yourself the injection. It's a very easy process, and with the practice, you will be an expert. So it's a matter of using clean needles, and after priming your needle into a pen, because it's like a pen, you find the right spot to inject yourself, and you should rotate the spots, and it should be away from the navel. So it's a very easy process, and you won't have any further problems because it's quite easy to grasp. Have you heard me properly, John?
Yes, sister. What are
Yes.
things like how to concentrate for taking this injection?
After using the injection, John, we have to discard it in a safe manner. I've brought this sharp container so that you can drop the needle without touching it. to avoid injuring yourself. So do you have any other questions, minimal, regarding taking the injection, the benefits of having the injection, and how to dispose the needles after the procedure? Do you have any other worries so that I can clear them out?
Okay, sister, you cleared all my doubts.
Thank you very much for your time. Yeah, if you have got any questions, here is our phone number. You can just give us a call. And if the situation is grave, you can dial 000 for immediate attention. Thank you for allowing me to explain this procedure to you. Bye-bye.
Thank you, sister.
All right. Both of you have done a good job by playing your role very well. Let me go through the assessment now. Firstly, I would like to give you the feedback on the words that you have used throughout the role play conversation, and then I will go through the assessment before I provide you the score. Okay. So firstly, the first in the beginning you have used, I have assigned by the doctor. Okay. That's the sentence you have used, but that's wrong. You should say I have been assigned by the doctor. Okay? To look after you or to do something, whatever you want.
Yeah.
And then the other thing is, in the beginning and in the end of the role play conversation, you talked at a faster pace, which is not good. Because when you spoke when you speak at a faster pace, it's going to make the examiner harder to understand what information you are conveying. It is mainly due to the influence of your first language. Do you understand? In the middle, it's okay. You are able to, go through each subtask and you are absolutely fine. You are on the track in the middle, but in the beginning and in the end, you talked at a bit faster pace, which is not good. Okay. So that's one of the mistakes you have done. And then the other issue is that you haven't pronounced some words properly. Okay. Instead of saying control, okay, you have said control. So that's how you pronounced. Okay. So it's not that good. All right. I'm not happy with the way that you have pronounced this word. And then you have said a couple of other incorrect sentences as well. You said injection in time. No, it is injection on time, not in time. Okay. And then you said you managed to lead. All right. You said you managed to lead a better life or so. But you should say you'll be able to manage. You'll be able to lead, or you can say you can manage. All right. You can manage to lead a better life or something. All right. And then you are able to share the information correctly and appropriately, but I recommend you to use more connecting phrases. Okay? So it's much better to use connecting phrases to convey the information. You were able to show sympathy to some extent, but there is an area of improvement in that particular section. It could have been improved. You should have shown the patient, oh, I'm really sorry to hear that. I would like to help you out on this, and you should persuade the patient. Okay, instead of just telling something else. Okay, you could have done it better, but you have done a decent job, but it could have been better. Okay. Vocabulary was all right. I'm happy with the way that you have used the words, so that's good. All right. And you were polite during the conversation, so that's good. All right. Your speech rate needs to be decreased, okay, because you're talking at a fast pace, as I already mentioned. So it may be a bit harder for minimal to understand, this conversation, isn't it, minimal?
Yes, sir. Sometimes feel like that.
Yeah, I think that would be much better. Yes. So in the beginning and in the end, it was pretty hard, for the non-native speakers, or if for the even for the native speakers, it may be a bit harder for them to understand what you would like to convey. So please slow down a bit. Okay. It's all about getting the information across. It's very important. Okay. You shouldn't let your first language influence on the English communication skills in a negative way. It's not good. I think one of the major areas is this. This is what you have to focus on. You need to work out on your speech rate. Your grammar is okay. At least 90% of the sentences were grammatically correct. Okay, only another 10% would need to be improved. But apart from that, you have done a wonderful job. Okay, grammar is all right. I mean, in most part of the sections. Most part of the speaking role play conversation. So I'm happy with that. You could have used the speaking strategies I taught you. So that's one issue. Okay, I have taught you 4 strategies, right? You could have used them properly. Okay. And what else? Okay. I think the problem, one of the main problem is sharing the information should be much better. Okay, you need to use less speed in order to convey the information. That's what I wonder. But apart from that, it was good. All right. Expected
She
score.
changed my name.
Oh, did you? Isn't it John, or did you do that? I was noticing the mistakes only. Sorry. Okay. So you shouldn't have changed the
Finally changed my
interlocutor's.
name.
Oh, the final one. Okay. All right. Interlocutor's name. That's not good.
Did I change it?
Yeah, I think you said John or something else, isn't it? Is that
Yes.
minimal?
Yeah, that's what he told me.
It's John, I think.
Yes.
You said John.
Finally you address me minimal.
No, minimal. Okay.
Okay.
Yeah. All right. That's not good. Okay. Yeah. Anyway, that's all right. But see. Okay, let me go through this one. So pronunciation is not that bad. It's only, I think, 1 or 2 words were not pronounced properly. But the speech rate, that's gonna make it really harder. That you need to understand, Ledwin. It's really harder. Okay, slow down further. It's okay. You can still finish all the bullet points in 5 minutes. Okay. All right. Don't panic. Feeling that you may not be able to complete all the bullet points within time if you speak at a lower pace. It's not the case. You can still complete all of them. Okay. According to me, I mean, this is not. It's because of the speech rate in the beginning and in the end of the conversation. Plus, you have changed the name, and then there are a couple of grammatical mistakes. Okay, they are the major ones. Because of all these things, I'm not quite convinced to give you 350. According to me, this may be really close to 350. Okay, I can give you maybe 330 out of 500.
Okay.
If you could have reduced the speech rate in both the beginning and in the end of the conversation, you should have been definitely able to get 350 with these many mistakes. Okay, do you understand? So with the same mistakes, you could have done that, because getting the information across is an important criteria as far as the assessment of the OET role play conversation is concerned. All right. You might have seen that there is a section called sharing information with the patient and getting information from the patient. Okay. So 2 things are equally important. So if you fail in one of the sections, it's not going to help you much. Okay. And that's why many students fail to achieve 350. They go really close to 350. They get like 330 or 340 and so on. But unfortunately, they do fail. Okay, very close to 350. They'll get only 320 or 330 or 340. And that's one of the main reasons. And they need to understand this. Okay. So you need to address the concerns of the patient as well. Please show more sympathetic phrases when you have to talk to the patient. Try to use a range of phrases. Try to
Okay,
address
thank you.
the patient's problems, you know.
Mm.
All right. Are you happy with my assessment, Ledwin?
Yes, I'm happy. Mm.
All right, no worries. Thank you.